wanted to show you my model tool and framework reference. As you can see, it is a front and back laminated copy with models on the front and frames on the back. They're each done by color, as you can see. Each thing has the primary theorist, core concepts, scenarios, and on the primary theorist, core assumptions, use when, and interventions. This is very important in practice and is also very important in grad school because we will be able to refer back really quickly without having to go through a bunch of PowerPoints or find it in the book or anything like that. We can just pull this piece of paper out, look straight at it. If we need to look further, we know exactly where to look. It'll be important in practice because I have the primary theorist here, so I can go back and look and see what kind of interventions they did with these certain types of models and frames for their patients, what research they did, if it can help me with my patients. I can also see which area my patients might fall into very quickly by just looking at the use when or the scenario situation. It's also a good way to mix and match because a lot of these can work together and they have similar parts. So I can see if one patient has this and that, can merge two together maybe, or even more. It's just a quick little tool. It's really important because it's the base of occupational therapy, and I'll be able to look back and remember in the future if my patients want to know, or my students want to know, or if I want to know myself. I can take this anywhere. I can put it at my desk. I can carry it in a folder. I can take it to another clinic. It's very versatile. I also have a copy on my phone, so I can take it literally wherever I go as long as I have my cell phone. So here it is. My favorite model is the OA model. It's because as the client becomes more adaptable to their environment, they'll be more functional, and I believe that is very true based on almost every aspect of life. As you become more adaptable to your environment, you will become more functional because most people can't just change their environment totally unless they move or completely create a new lifestyle. So it's more apt for the patient to become more adaptable to their environment, their current environment, rather than to completely change their environment. Another one on the frame side, my favorite is the motor task. It's because it's a top-down approach, it's restoring functional movement, and it has meaningful tasks that the patient wants to participate in. Similar to OA, it's all about meaningful tasks, and I feel like that is a very important thing in occupational therapy.